Now to the latest on the Ebola crisis. A second Dallas nurse has contracted this disease. Late tonight, she arrived at Emory Hospital in Atlanta. We've also learned she flew from Texas to Ohio. All of this after treating the first Ebola patient who died. Healthcare professionals in the Bay Area are on edge this evening. News Channel 8's Peter Bernard is live at Tampa General Hospital. Peter.
Good evening. Not only did she have the disease, as you mentioned, she flew from Dallas to Cleveland, possibly putting others at risk. Now there are new concerns about Florida's efforts to possibly contain Ebola should it ever come here. On the sidewalk in Ybor City, Bay Area nurses, encouraged by a nurses union, staged a die-in. These healthcare professionals don't believe Florida is fully prepared for an Ebola outbreak.
It is frightening. It's frightening to nurses, especially nurses on the front line. It's frightening to the patients that come into our hospital that ask us, do we feel ready? Are we scared?
Brooksfield nurse Kim Scott believes proper protective gear and training is not being made available, nor is instruction on putting the gear on and taking it off.
You know, all of us are trained in isolation techniques, but unfortunately, the basic techniques that we've used have shown in Texas not to be effective.
Nurse Scott may soon get some help from Governor Rick Scott. Reacting to this latest Ebola threat, he's calling on the CDC to instruct hospitals on best practices, considering the Dallas lessons learned. He wants new safety guidelines within 48 hours and federal funds to buy more protective equipment.
If my wife or my children had it, I would give it to them right away.
Meanwhile, a Clearwater company, Ogenics, is working on a drug it believes could treat Ebola. I spoke to the CEO via Skype.
I think during this crisis, we have to throw out the book. I mean, we can't follow the standard rules right now.
And that drug is called RC2 beta. And Dr. Davis says it's shown promise in animals and humans against a whole bunch of viruses, including Ebola. Keith?
But Peter, it's still way too early to send this to Ebola patients, right?
Yeah, it has to go through the FDA approval process. Dr. Davis says they want to experiment on a much wider basis and make sure it works. But his idea is that if you've got Ebola and nothing else will work, why not try it?
All right, Peter Bernard reporting live at Tampa General. Thanks, Peter.